So we'll start with a bit of background information. A lymphoma is a type of neoplasm that occurs in lymphoid tissues, which is mainly classified into Hodgkin lymphoma and a non-Hodgkin lymphoma. The Hodgkin lymphoma has an incidence of 2.6 cases out of 100 people, roughly, and represents 11% of all lymphoma cases. And most of these cases occur in 20 to 14 years old of age group, and those above 55 years old mostly. So then there's the non-Hodgkin lymphoma, which is the fifth most encountered cancer in pediatric cases. And in non-Hodgkin lymphoma, the T-cell lymphoma is the most common subtype in Asia. And the non-Hodgkin lymphoma is most commonly seen in those aged 65 to 74 years old.
Here are the research questions of the student project. The first is, what is the definition of lymphoma? What is the etiology of lymphoma? What is the pathogenesis of lymphoma? What are the clinical features and diagnosis of lymphoma? What is the differential diagnosis of lymphoma? What is the treatment and prevention of lymphoma? What is the complication of lymphoma? And how is the prognosis of lymphoma? Here are the purpose of the research in this student project. First, to understand the definition of lymphoma, to understand the etiology of lymphoma, to understand the pathogenesis of lymphoma, to understand the clinical features and diagnosis of lymphoma, to understand the differential diagnosis of lymphoma, to understand the treatment and prevention of lymphoma, to understand the complication of lymphoma, and the last is to understand the prognosis of lymphoma. Benefits of the research in the student project consists of two benefits. The first is as the basic information about lymphoma for the future research, and the second is increased knowledge about lymphoma.
Definitions of lymphoma. Lymphoma is a malignant tumor of lymphoid tissue characterized by abnormal proliferation of B cell and T cells in lymphoid tissue. It also can caused by NK cells neoplasm. So generally, there are two types of lymphoma. The first one is Hodgkin lymphoma. Hodgkin lymphoma is also known as Hodgkin disease. It's a group of cancer characterized by red Steinberg cells, which is an appropriate reactive cellular background. In Hodgkin lymphoma, there are no specific symptoms. And the second one is non-Hodgkin lymphoma, that there is no red Steinberg cell. In non-Hodgkin lymphoma, there is more extranodal involvement than Hodgkin lymphoma.
The etiology of non-Hodgkin and Hodgkin lymphoma are quite similar. First is immunomodulation that consists of congenital and acquired immunodeficiency. And this etiology can cause lymphoma due to the deficient immune surveillance, defective immune regulation, and chronic antigenic stimulation caused by other infections. The second etiology is viruses such as Epstein-Barr and human T-cell lymphotropic virus. These viruses can cause impaired control mechanism that lead to B-cell or T-cell proliferation and resulting in lymphoma. And the last etiology is genetic. According to some studies, there are increasing risks of developing Hodgkin lymphoma in same-sex siblings of patients with Hodgkin lymphoma. This suggests the interaction between the gene and the environmental.
Non-Hodgkin lymphoma. Non-Hodgkin lymphoma is derived from lymphocytes which undergo rapid proliferation caused by infection and other factors. This will result in higher chance of replication error. Alteration of germinal center which control B cell proliferation is other factor in this disease. Non-Hodgkin cell express abnormal oncogenic genes which will accumulate in the next few generations. It will increase growth and survival, inhibition of apoptosis, and immune escape. Hodgkin lymphoma. Hodgkin lymphoma is derived from lymphocyte B, which undergo change caused by external factors such as EBV infection. These changes, including expression of genes which promote its survival, inhibit normal apoptosis, telomere protection, and chromosal dysfunction. This will cause formation of Hodgkin and RS cell. Hodgkin lymphoma also have the ability to attract immune cell to increase its survival by creation of tumoral microenvironment.
Now about the clinical features. The clinical features of Hodgkin's lymphoma are: first, lumps under the skin is the most common symptoms. It's caused by lymph enlargement. Alarms doesn't hurt as if you are consuming alcohol. Second is constitutional symptoms. These symptoms include fever, weight loss, changing night sweats. Third is trouble breathing. The swelling in the chest or the trachea, causing cough, chest pain, and trouble breathing. Fourth is black wound pain. It's result of lymphoma inside chest, while symptoms of non-Hodgkin's lymphoma are first swollen lymph nodes, which is caused by lymph node enlargement. Second is B symptoms. It refers to fever, weight loss, and changing night sweat. Third is skin problem, is usually itchy. Fourth is trouble breathing. The causes are some with Hodgkin's lymphoma. The fifth is abdomen pain. Swelling in abdomen causes abdomen pain.
My name is Etienne. Today I want to describe about the differential diagnosis about the lymphoma. There's a small difference between nodular lymphocyte predominant in HL and classic HL. Hodgkin lymphoma. These two can be differentiated based on morphology and immunophenotype and of the inflammatory background. Differential with PL-LBCL and DLBCL has shown Hodgkin-like feature like anaplastic large cell lymphoma. PML-BCL shown neoplastic cell similar to HRS cell and positive for CD30, CD45, CD20, and CD79A, but negative for CD15 and EBV. CHL, PML-BCL, and DLBCL are that have similar morphological, biological, and clinical feature are defined as gray zone lymphomas. Thank you.
Prevention. There's not a lot of prophylactic measures to prevent both types of lymphoma. At the very least, the general populace should maintain good general health and perform precautionary actions such as eating balanced diet and washing hands regularly. Treatment. Non-Hodgkin lymphoma requires a combination of four main treatments: chemotherapy, radiation therapy, immunotherapy, and targeted therapy. Therapy regimen is generalized into two types of NHL, aggressive and indolent form. Aggressive form. Immunochemotherapy regimen used is R-CHOP, which is then followed by radiotherapy. Indolent form. Surgical excision or radiotherapy for when the patient presents with localized lymphadenopathy. For asymptomatic patients, a watch and wait approach is used. Hodgkin lymphoma, a combination of chemotherapy using the ABVD regimen and radiation therapy. Therapy regimen generalized for three types: early stage and favorable prognostic, early stage and poor prognostic, and advanced disease. Early stage and favorable prognosis requires 2 to 4 cycles of combination chemotherapy, followed by radiation therapy of 20 to 35 grays. Early stage and poor prognostic requires at least 4 cycles of combination chemotherapy, followed by radiation therapy of 30 grays. Advanced stage, only combination chemotherapy is used.
Hodgkin lymphoma complications associated with therapy. Therapy such as chemotherapy and or radiotherapy will cause various complications. Patients who are treated with chemotherapy experience nausea, vomiting, fatigue, sore throat, bone marrow suppression, throat problems, heart and lung problems. Besides, patients with radiotherapy effect can cause nausea, vomiting, sore mouth, loss of appetite, diarrhea, hair loss, cystitis, muscle, and joint pain. Both chemotherapy and radiotherapy can cause infertility and second cancer, such as breast cancer, lung cancer, and leukemia. Just like Hodgkin lymphoma, non-Hodgkin lymphoma complication can also be caused by chemotherapy and radiotherapy. Myelosuppression, neutropenic fever, immunosuppression, and secondary malignancies such as myelodysplastic syndrome and acute myeloid leukemia can be experienced in patients with chemotherapy. Besides, patients can also develop squamous cell carcinoma of the head, neck, and breast cancer. Non-Hodgkin lymphoma patients who are radiated to the neck and mediastinum may develop hypothyroidism. Other complications are febrile neutropenia, gonadal dysfunction, superior vena cava obstruction, hyperleukocytosis, venous thromboembolic disease can be observed with small lymphocytic lymphoma.
And now for the prognosis of lymphoma. To determine the prognosis, we have the staging system, which the first staging system for lymphoma is Ann Arbor staging system, but now it is limited. That's why there are new models and systems that are being used, such as Hodgkin Lymphoma International Prognostic Score, International Prognostic Index or IPI, and Follicular Lymphoma International Prognostic Index or FOPI. And for the prognosis itself of non-Hodgkin lymphoma and Hodgkin lymphoma is quite different. For the non-Hodgkin lymphoma, the prognostication that being used is International Prognostic Index or IPI, and based on the factors, patients are grouped into low risk, low intermediate risk, high intermediate risk, and high risk, with the predicted 5-year survival rates of these groups, respectively are 73%, 51%, 43%, and 26%. As for the Hodgkin lymphoma, the prognostication that they use is International Prognostic Score or IPS, and the 5-year overall survival stage for stage 1 or stage 2A of each patient is around 90%. For the stage 4 patient, it's around 60%. And lastly, 90% of all patients diagnosed with HL or Hodgkin lymphoma are long-term survivors.
So the last part is the conclusion. As we come to the conclusion, so the first conclusion of this project is first, a lymphoma is a type of neoplasm that occurs in the lymphoid tissues, which derivates from both lymphocyte precursors and mature cells. Second, both of non-Hodgkin lymphoma and Hodgkin lymphoma have similar etiology. There are immune modulation, viruses, and genetic. Third, the clinical features that appear in both of lymphoma are lump in the skin, constitutional symptoms: cough, chest pain, trouble breathing, backbone pain, swollen lymph nodes, B symptoms, skin problems, trouble breathing, and abdomen pain. Fourth, there is not a lot that can be done to prevent both Hodgkin lymphoma and non-Hodgkin lymphoma. Fifth, there are 4 main treatments of lymphoma, which is chemotherapy, radiation therapy, immunotherapy, and targeted therapy. 6. Main complication of lymphoma is caused by therapy like chemotherapy or radiotherapy. And the last one is the staging process was deemed important to determine the prognosis of lymphoma. So that's all from us. Thank you.